were a total of 189 COVID-19 outbreaks reported in Washington K-12 schools between August 1st and September 30th of this year. 42 of those outbreaks occurred in August and 147 happened in September. There are 1,284 cases associated with these outbreaks in August and September, and the majority of cases, 88%, were among students age 19 and under. The month of September is the highest number of school outbreaks we have seen and had reported to us since starting this tracking with the return to school in fall of 2020. However, I want to share some important contextual things that are different this year. First of all, we're facing a more transmissible variant. The next is that we have a very high level of community transmission, and it was even higher during the months of August and September. We've seen over the course of the pandemic that outbreaks among school-age students correlates directly with the amount of disease in the community. So we would expect to see a high number of introductions into the school environment and a higher risk for outbreaks in schools. The third factor that I wanted to mention is that for the first time since the pandemic was declared in March of 2020 and schools closed and went to remote learning, we are offering full-time in-person instruction to all students this fall. So that means there are more students in a building or classroom at a given time, and they're present more days of the week. I do also want to share that the outbreaks are relatively small. The median number of cases in each of these outbreaks is 5. So that relatively small number of cases in each outbreak is an indication that schools are continuing to do a really good job on layered prevention measures and responding when they have cases and outbreaks. So it's a good signal to us that the layered prevention measures are working and schools are ready to respond when there are cases.